I took my CMT state exam. Those are questions where how did I prepare? I didn't really do a lot of preparation during the test. Just be aware of the patient's
I passed! I'm officially a certified medication technician. And I'm home. Hey lovelies, it's me again, CHRISTIDEL presents, and welcome to my channel. So in today's video, I am going to talk about last Monday, which I took my CMT state exam, and finally I passed and I made it. I am officially a certified medication technician. So without further ado, if you want to know how my test goes, stay tuned and we'll talk about it. Once again, thank you for being here again with me today. For the new subscribers, welcome! And for those who are curious on how I got into the CMT program, you can watch my last videos about becoming a medication tech. I will link it down below for you guys so you can watch it. So once again, this is only based on my personal experience. So how was the test? It was a little bit easier than I expected. Some of the questions were... My dog just sat on his toy and it made that squeaky sound and it sounds so funny. Look how grumpy he is. TJ, what are you so mad about? That was the squeaky toy. That toy, the yellow one, his yellow banana dog. He's sitting on it. Hi, big brother. Kuya CJ. So going back, so the test was actually easier than I expected. Some of the questions were tricky, yet I was able to answer them. So yeah, so far it was okay. So how did I prepare? I didn't really do a lot of preparation during the test. Although I did spend a day with a friend of mine. We studied together at the coffee shop. We're both in the same program, so yeah, we decided to study together. And other than that, because I was working that week before the finals, all I did was to cram after work. So let's say I crammed 3 nights in a row before the finals. So that was about it. I didn't really do a lot of preparations. I didn't have time, I didn't have the energy, so yeah, I just did all I can. During the time while I was reviewing, I focused on certain topics like the normal aging process, the basic review of the body systems, and the common medications in each body systems. I also try to focus about the infection control and the generic names and brand names of the medication, as well as their indication, contraindications, the side effects, what to report to the nurse, as well with MAR, which is Medication Administration Record. I also try to get familiarized with the measurements and being mindful about the patient's rights. I also read about the responsibilities of the CMT upon administering controlled medication. I believe that in other facilities, they allow their CMTs to administer controlled drugs. However, in our facility, we are not allowed to do that. So for me to be able to review for the skills test, I just read all the procedures that are provided in our book. And basically while reading on that procedures, I just tried to reminisce or think during our clinical experience for like 8 hours. I know that 8 hours wasn't enough as a clinical experience, but that's the only requirement for the program. And I also watched a few videos on YouTube, and that was the major help. So overall, the test was so easy, guys, so you don't have to worry about it. Alright, so this is how it started. So basically, there's only 2 of us during the test, and the test started with a written test around 8:25 in the morning, and there were only 50 items. I assume we were given like 2 hours to complete the test. However, it didn't take as long. We finished like around 30 minutes or so. For me to be sure, I tried to review my answers before submitting it to the examiner, just to be sure. And she also informed us that if we passed the written test, then we can proceed to the skills test. And luckily, both of us passed. And right after she announced that we passed the written test, she gave us like around 15 minutes break just to go to the bathroom, relax and all before proceeding to the skills test. And since there were only the 2 of us, I volunteered first to do the skills test just for me to get over with. And during the skills test, we technically have to pass meds to the resident or to the patient. And the examiner will be the one to choose on who's the patient that you would work with. In this part of the test, we have to prepare and administer non-parenteral medication. So basically, you have to review the MAR, the medication administration record, for any patient's allergies. So this is the time you can review the patient's chart. You have to assess their pain, perform vital signs if needed. While preparing the medication, you observe proper infection control like hand washing, using antibacterial gels. You also have to report to the charge nurse if there are any side effects that needs to be reported to. Make sure to always chart, document all the time. Keep that in mind. Honestly, I was so nervous during that time. The only advantage that I was holding on was because I am currently working that facility. I have already established a relationship with all the residents. I already know how to approach them, communicate with them, so that was an advantage. Always remember to perform hand washing before and after each patient, and especially while you are preparing the medications.
Always be aware of the patient's
Be aware of the 5 patients, right patient, right drug, right route, right dose, and right time. Always start, especially after you administer the drug, and if the patient will refuse, you also have to chart that on MAR. We were not able to perform these procedures during the skills test. It's the vaginal and the rectal suppositories. It is because we don't have any resident that has any doctor's order for the suppositories. Because we were not able to do the vaginal and the rectal suppositories, we kind of just verbalized everything. Like we kind of did a simulation for each steps of the procedure, and right after that she finally announced that we passed the skills test and we are officially CMTs. I believe we'll receive the certificate right after the paperwork. And by the way, I'm not certified to administer insulin yet. It is because I haven't gone through the training yet, and that would be the next step since we already passed the state test for the CMT. I'm currently waiting for the further instruction of our director of nursing regarding the insulin training program, so I'll keep you posted. I'll make sure to update you guys on what I'm gonna do next. Thank you for all your love and support, and I'll see you next time. Bye!